You may please take your seats. His Excellency, the Vice President of the Federal Republic of Nigeria, Senator Kashim Shettima, GCON, Honorable Ministers and Heads of Delegations here present, Director General, African CDC, Heads of Institutions, global, regional, and national, members of the Diplomatic Corps, leaders of international and multilateral organizations, distinguished partners, gentlemen of the press, ladies and gentlemen, good evening. I am Dr. Adeze Okonkwo, and I am honored and delighted to welcome you to this high-level side event, co-hosted by the Federal Republic of Nigeria, the African Union Commission, and the African Center for Disease Control and Prevention, taking place on the margins of the 39th Ordinary Session of the African Union Assembly of Heads of States and Governments. We are deeply honored by the presence of Your Excellency. Today's dialogue focuses on advancing Africa health security and sovereignty through strategic investments in health workforce, community health systems, and sustainable immunization programs. Three mutually reinforcing pillars for resilient primary health care: pandemic prevention, preparedness and response, and universal health coverage. Specifically, we expect the side event to strengthen continental political leadership and visibility on health workforce and community health worker initiatives, reinforce political ownership and accountability for the AU Health Workforce Compact, and operationalize the AU Health Workforce Task Team as the central coordination mechanism. Accelerate progress towards 2 million community health workers by 2030, including systematic monitoring and reporting. And finally, elevate health workforce and community health workforce financing as a strategic investment for primary health care, immunization, and universal health coverage. To start off the conversation, it is my pleasure to welcome the Coordinating Minister of Health and Social Welfare, Federal Republic of Nigeria, Professor Mohammed Ali Pate, for the opening and the welcome remarks. A round of applause for him, please, as he comes up to the stage.
Your Excellency, Senator Kashim Shettima, Vice President of the Federal Republic of Nigeria, here representing His Excellency Bola Ahmed Tinubu, President of the Federal Republic of Nigeria, and the African Union Champion for Human Resources and Community Health Delivery Partnership. His Excellency, the Chairperson of the African Union Commission, here also ably represented, my dear brother, His Excellency Dr. Jean Kaseya, Director General of the Africa Centers for Disease Control and Prevention, my brother, the Honorable Minister of Foreign Affairs of the Federal Republic of Nigeria, Honorable Ministers, my brothers and sisters from Senegal, Malawi, Ethiopia, Botswana, and several other countries that are here, and all leaders across the continent, heads of delegations, our numerous development partners from the Gavi Alliance, from the UN system, UNICEF, as well as other partners, other friends of Africa, ladies and gentlemen. Let me start us off by telling you a story which brings this issue that we're here gathered to the fore. This is a story of an area in Kano, in central northwestern Nigeria, where a dedicated community health worker named Amina recently walked for hours across dusty paths to reach a hamlet where she found one of the boys who who had never received a single dose of immunization, the so-called zero-dose child, therefore vulnerable to diseases that are ordinarily being preventable. Amina is a community health worker. Is working on the front lines, and thanks to her commitment and training, that child received life-saving immunizations, life-saving interventions, other interventions, and the family gained renewed confidence in the health system that it cared for them in helping prevent diseases. This story is not unique. Across Africa every day, there are similar stories of hope, of deliverance by our community health workers. But there are gaps, and the gaps remind us of why our work is urgent and why we are gathered here together today to discuss it. It is therefore an honor to join, and I thank the Africa Union Commission and especially the Africa CDC for partnering with Nigeria and for partnering to support the leadership of His Excellency President Bola Ahmed Tinubu as the Africa Union champion on this important issue. I thank you for joining us in this important dialogue. Today, we will address how to strengthen Africa's health security and sovereignty by investing in our own workforce, investing in community health systems, immunization systems to save lives. These priorities are central to African health security and sovereignty and the Agenda 2063. It's not when you have crisis that you start investing in health and health systems. It's too late. It's in between crises that we need to build those community systems as a basis for our resilience when a crisis were to emerge. As we work towards the universal health coverage by 2030 as a continent, even as we confront many rising disease threats, climate challenges, our incredible demographic challenges and changes that are facing us, we can rally around this shared vision of a healthier Africa, a secure Africa, and work towards our collective destination together. Peace and prosperity also rely on health. Families cannot thrive with the basic things that they need for their children, for their women, for adults, for the aged. Trained community health workers and responsive health systems are key to this. We have the evidence, we have the tools and the expertise. What remains now across our continent is continuation and strengthening of our own political will to act collectively to bring this issue to land it in a way that will help us meet our objectives. Excellencies, Nigeria is committed to leading by example. And by 2027, under the leadership of Mr. President and the Vice President, we declared that we wanted to retrain 120,000 community health workers in the frontline nationwide, integrated with our subnational state health systems. We've already retrained almost 80,000, and we're on a path to get to the 120,000 and more. This sets us on a path and signals the determination by Nigeria to turn our ambition through concrete action to reality. We also launched the Maternal and Neonatal Mortality Reduction Intervention Initiative, so-called MAMI, 2 years ago, directing resources to the most affected local government areas through a unified sector-wide approach, 172 local governments. MAMI has strengthened the health workforce, it's strengthening our value chains, we're beginning to see movement on the production, and is helping states to recruit, train, and deploy health workers and for them to be retained, bringing federal government, states, and local governments. We've also improved on our national workforce data systems from just one that is less evidence-based to one that has data to guide it. The Nigeria Health Workforce Profile was completed in 2024, which offered us a comprehensive view of workforce distribution, the rural-urban gap, the mix of cadres, the density, and the migration trends. And one headline finding stood out in this effort. The average density of our skilled workers in rural areas is just 1.2 per 10,000 people, compared to 6.5 per 10,000 people in our urban centers. So the maldistribution, this stark disparity underscores the urgent need to close the rural-urban divide, even in our country, and I'm sure in many other countries on the continent, so that we ensure that every community, no matter how remote, has access to essential services. And recognizing the challenge that we all face of skills mobility, we were among the first AU member states to approve a standalone national health workforce migration strategy and an implementation plan. This has positioned us at the forefront of ethical, sustainable, and well-governed health workforce mobility. And my colleague, the Minister of Foreign Affairs, and other colleagues in government were working towards ensuring that those who travel out, the health workforce, at least we're able to produce more. The idea of increasing the production of the health workforce so that we can retain some, even if some are able to are leaving our shores for better areas in the world. Our experience in Nigeria shows that political leadership, domestic financing, and institutional reforms can lead. In Nigeria, we're translating that, and I'm sure we will have each of our countries, but working collectively. And I thank my brother, the DG Africa CDC, who is proposing that Nigeria host another conversation based on the investment case, so that we raise the resources to enable this dream to turn into reality. Because community health workers will offer us one of the fastest ways to improve population health outcomes, to ensure we have a resilient health system for when there is a crisis, and that we work together. Excellencies, ladies and gentlemen, there are three concrete time-bound commitments that I urge us to consider. First, funding. We must have the finance domestically mobilized with external support where necessary, national, federal, states, local government, wherever it is, including the private sector, to crowd in this effort. And we have to foster this idea of a community health workforce as the backbone. The community health workers, whether the extension workers or the community-based nurses, midwives, or other health professionals, to be the backbone for our efforts. And the tools provided by the African Union can help us closer. And finally, to secure resilient and sustainable systems for things that are really within reach: immunization, vaccines, the most cost-effective public health intervention that prevent diseases, reduce the number of zero-dose children that are missed, so that there is something tangible. It's not just about the system working for itself, but the system working for people. And if it's to work for people, it has to deliver something tangible. And what is tangible may just be a drop of vaccine, treatment for a pregnant woman, multiple micronutrient supplement, azithromycin, seasonal malaria, chemoprophylaxis, or other things that people will believe that the system works for them. So when there is crisis, if you ask people to mask up, to take vaccine for a pathogen that is emergent, they will trust it. The mistrust can be breached if we deliver those basic things at the community level. And for us to do that, not only within our nation states, I believe continental coordination is going to be critical. Accountability will be key. We are diverse on this continent, and our challenges may be slightly different in different areas, but yet our destiny is shared. So let us make 2026 the year we turn our various plans into measurable progress, and together we can achieve much. And the spirit does not live in one place alone. Nigeria stands ready to work with all partners to make health security and the Africa we want. His Excellency, the Vice President, is here, and we'll hear from him later. But I'm sure that the African Union and all of us will redouble our commitments. To all excellencies and invited guests, we are very grateful for your presence and for accepting our invitation, and we thank you all. Thank you very much.
Thank you very much, Coordinating Minister, for those inspiring remarks on Nigeria's journey under the leadership of His Excellency, and for underscoring the strategic importance of investing in the health workforce, community health, and immunization systems. Excellencies, we will now hear from the institution leading the continental agenda on Africa's health security and sovereignty, and coordinating collective action to build resilient health systems across our union. To provide the continental framing and to set the scene for today's discussion, I am pleased to invite the Director General of the African Center for Disease Control and Prevention, His Excellency Dr. Jean Kassenya. Let us welcome him to the podium with a round of applause.
Your Excellency, Kashim Shettima, Vice President of Nigeria, let me first stop there. I learned in my life that it's not our positions that are creating people, it's people who are creating positions. They are giving a sense in these positions. My first meeting with you was in Davos. I was sitting with you and President Ramaphosa. Your intervention made the room crying, thinking about the future of this continent. I can still remember what President Ramaphosa told me. Nigeria is in good hands with a vice president like you, supporting President Bola Tinubu. Let me recognize my dear brother, Professor Ali Pate, one of the ministers who are making us proud. You know, when I'm somewhere he's not around, I'm asking myself, where is Minister Pate? Because we need to see you everywhere. We need to clone you. Maybe we need to have you in all meetings, but also in Nigeria. I attended the annual review meeting. I saw the wonderful job you are doing. I was talking with your Minister of Finance. I said, it's just amazing. You are inspiring. And I committed to you, next year we'll bring some ministers to see also what you are doing, because this is the community of best practice we need in Africa. But also, Ambassador Yusuf Tuga, thank you for your support. You are a true member and a strong voice of the Executive Council. For your information, all of our decisions in the Executive Council passed because he supported that. Please let us applaud for him. I want to recognize all Ministers of Health, my dear colleagues and brothers and sisters who are here, all partners who decided, despite their busy agenda, I can see, let me just recognize Winnie. Winnie, you are there. You are a true champion for community health focus. Thank you for coming, and so many other leaders. Colleagues, I was told to set the scene today, and I hope it's working, this one. Apparently it's not working. Who can help me? Okay. Then I have some slides. For you to see where we came from and where we are going. But if you don't see my slide, it will be, it's working? No, here. Okay, now it seems it's working, but I don't see it here. Okay. Thank you for joining us today. You know, we are talking about a vision. We are glad, and I'm part of this generation that can say we are proud to see we have strong leaders. Here represented by the Vice President, but so many other leaders. We had the opportunity to meet some of them today. President Mahama John from Ghana, when he decided to launch Accra Reset, it was a movement. We were inspired by what our leaders are doing, Kagame, Mahama, Bola Tinubu, and so many others, to come with this vision that we call Africa Health Security and Sovereignty. And this vision is to say that it's not a slogan. It's to say we need to move on. Our continent is ours. Our destiny is ours. And we need to say this is what we need to do as best practice, as concrete action to move on. Today, Africa is still facing a challenge, 6 million shortage of health workers. If we don't do anything, if we don't stop that, we are facing a major trouble. But we are glad that we are moving. This 6 million is a challenge, but the challenge, even if it's systemic and interconnected, we have some descriptions. What are we facing as major challenges? The first one, we do not have enough, but also very skilled people. The second one, we are losing critical talent to higher income market. The Minister of Egypt was telling me the musts we need to do is to retain our people here in Africa, because Egypt is losing 100 young doctors every month going to Western countries. The third one, we are talking about the fragmented system. Today, it came to us that we are losing around 20 to 40% of our total health expenditure because of the fragmented system. We are also talking about this data issue. No one in this room will forget that when USAID stopped with support, countries faced a major issue like Kenya, where data disappeared out of the blue. But we know when we have challenges, it's also opportunity. The first opportunity we have is what AU decided to put in place as political guidance. In 2017, our head of state decided to have this agenda of 2 million community health workers. This is different from community health workers we had in the past because we are calling them institutionalized community health workers. We need them to be trained, equipped, even getting some salary to do their job. The second one, it was what we call the Addis Declaration in 2017 on immunization, linked to community health worker. The third one was in 2022 when the Assembly decided to put in place the AU Health Workforce Task Team. But everything was just a desire. Till when, in 2024, we had a leader who decided to stand up and to say, I want to lead this agenda, I want to make it moving. President Bola Tinubu accepted to become AU champion for human resources for health and community health workers. At that moment, we have some movement in the world, and I told them, even if you need to become the world champion, it will be the world champion, not only the AU champion. If Omar Abdi from UNICEF, Atul from USAID were here, they know what I told them. For me, I consider President Bola Tinubu not only as the AU champion, but the world champion for the community health worker. We are a secretariat. We are so glad to see our leaders supporting and guiding us. As Africa CDC, what we did to support our president, we launched the Health Workforce Compact in 2025 to guide investment, but we'll come back to this investment. We established the Health Workforce Task Team as the continental coordination mechanism for human resources. We established the Continental Coordination Mechanism for Community Health Workers in 2023. Let me disclose to you something. And I know my sister Senite is here. She likes to hide herself. I didn't see Senite. I know she's here. Where is Senite? Where is Senite? Okay, she's somewhere. But I saw her. In 2023, we had a meeting with a number of partners. I wanted to know how much do we have available for community health workers. World Bank didn't provide figures. The US, they didn't provide figures. For a few partners who were there, they told me, we have $4 billion available for Africa, for community health workers. And then I said, where is this money? This is why we need this continental coordination mechanism, working closely with countries to know Nigeria must tell us, Uganda must tell us, Malawi must tell us where is money. It's not what partners are telling us, it's what countries are telling us that will be the accurate figure. And we need to come under this continental coordination mechanism to work together. Then, we decided to move on and to make things working for our member state. We conducted a study that provided only 20 out of 55 countries. In Africa, we are talking about 55 countries because Sahrawi, and I know that the Minister of Finance of Sahrawi is somewhere. Minister of Finance Sahrawi, thank you for being there. Excellency Vice President, this is the Sahrawi country. 20 countries out of 55, they are dedicating a national budget. But what is worse, out of the 20, only 11 are linking that with a sustainable financing mechanism. This is not what we want in Africa. And if we go deeper, we saw only 5% have a budget more than 80% for the community health focus. It means we are not really providing funding for our community health focus. We also decided to work on the governance of the community health focus at country level and the continental level by linking that, especially at country level, with the primary health care and the immunization and HIV delivery. Without community health focus, today the progress we made on HIV will not be possible. Without community health focus, the progress we made on immunization will not be possible. And we know that 84% of our member states, they have community health strategies. Very good. This morning I was saying the problem is not lack of strategies and tools. 69% of them, they recognize community health workers as part of the national health workforce. 96%, they are having design, they are institutionalizing the community health worker mechanism. What is the issue? We still have the coverage issue. We said 2 million. Thank you to Nigeria. Last year, we went to disclose the study that we conducted that showed that we already reached 50% of that, around 1,042,000 community health workers already deployed. Just less than around 50%, but we can say out of this 50%, less than 30% are really supported and on more sustainable way. While 61% of our member states, they are allocating budget for community health focus, look, only 6. Only 6. I don't want to talk about 12%. Only 6 have over 80% of community health worker program fully supported by national budget. I want to thank countries like Namibia. This is one of the countries where we see the progress is made. 100% community health workers in Namibia are paid by the government. But I want also to recognize all other countries. I see the Minister of Botswana here with the progress we are making. Colleagues, I was talking about the immigration issue. By 2063, we'll have more than $1.4 trillion we are losing because our main power is moving to Western countries. Some of you here, you are working in Western countries. You decided to come back to Africa. But we know we have so many brothers, sisters trained in Africa who are moving there. It's a major issue. But let me also say it. In Africa, some African countries, to have an African working there, he must become a refugee. If you don't accept that, you will not get the work permit. It means even in Africa, we are not just talking about Western countries. In Africa, the way we are treating our brothers and sisters is not acceptable. We need to say it because Ministers of Finance are here. There is a return on investment. When we are investing $1 in the health workforce, Minister of Finance, you are getting back $17. It means put your money there, you'll get more. And we are also saying to the Minister of Finance, when you invest $1 in community health program, it will generate around $50 in benefits for the system. That one, the clear message is investing in health workers is not expenditure. It's a highly economic policy which will contribute to reduce gender inequalities. I know a country where 65% of community health workers are women and things are moving very well. I trust ladies. I even to say, if ladies are leading this continent more, this continent will move faster than it is today. Then, Dr. Professor Patti, I don't want you to become a lady, but I'm just saying, this is why I recognize some of our leaders female. But let us go quickly on recommendations. I was saying to Professor Patti before coming here, we need first to elevate human resources for health and community health workers as a sovereignty priority. We know investing there is bringing a lot of benefit, not only in terms of economy, but also as we said about HIV, as we said about immunization, as we can say about malaria, health security. We know also that when we decide to operationalize the continental coordination mechanism and the national coordination mechanism, we are winning. Colleagues, today, it will be the first time I disclose that in public. In September 2024, I was meeting US colleagues. I told them, open your book. I don't want you to come again in Africa to tell us you are putting $30, $40 billion. No one knows where this money is going. I made pressure to them. They gave me that in November. I sent it to all ministers. No one told me that he was recognizing the amount of money that was there. December, it was election in the US. January, President Trump took power. February, I was in Washington. If people, they want to know the story of America First Global Health Strategy, we can tell them. February, March, April, we had 4 sessions with all US agencies at State Department. What was the message? Give money directly to African countries. Ask them to co-finance, and you'll see they will do miracle. This is why I love Susan Buffett. Susan Buffett decided to give money to African countries. Today, a country like CAR, I think Sonse is somewhere, a country like Nigeria, they are getting money from Susan Buffett. They are using this money. I didn't hear about any scandal. Baroness Chapman said this morning, or this afternoon, we need to start to give money to countries. Colleagues, this is the new approach. Money must come directly to countries. We need to stop with unnecessary implementing partners. A minister was telling me today, it was the Minister of Finance of CAR, we stopped with some implementing partners because they were getting 35 to 40% of our money as overhead. This is not acceptable. No one here can accept that. Believe me, with Patti, with Sonse, with all of you, we'll be up we say the new model here today is sovereignty. It means money to countries and follow our leadership. Excellency, I want you to challenge us. I want you to challenge partners. I want you to support us to make this agenda moving for the community health focus. Thank you so much.
Indeed, Nigeria is in good hands, and Africa is in good hands with Nigeria as Big Brother Africa. Thank you, Dr. Kasaya, for that comprehensive overview. To further reinforce this continental vision and its policy anchoring within the African Union, it is now my honor to invite His Excellency Ambassador Amoa, the Commissioner for Health, Humanitarian Affairs and Social Development of the African Union Commission, and she is ably represented by Professor Julio Rakoto Nirina, the Director for Health and Humanitarian Affairs. He will be delivering his remarks in French, and we will keep that to 3 minutes.
Thank you so much. As VMC said, I will deliver my remarks in French. Votre Excellence, vice-président de la République fédérale du Nigeria, représentant son Excellence, président de la République fédérale du Nigeria et champion de l'Union africaine pour les ressources humaines dans le domaine de la santé et la prestation de soins de santé communautaire. Honorable ministre, Son Excellence Dr Jean Kassea, directeur général de Africa CDC, Excellences, Mesdames et Messieurs, tout protocole observé. Au nom de Son Excellence l'ambassadeur Ahmed, moi, commissaire de la santé, des affaires humanitaires et du développement social de la Commission de l'Union africaine, j'ai l'honneur de m'adresser à cet événement parallèle de haut niveau co-organisé par le Nigeria, Africa CDC. Je tiens tout d'abord à féliciter Son Excellence le président de la République fédérale du Nigeria pour son leadership en tant que champion de l'Union africaine pour les ressources humaines, à une époque où l'Afrique redéfinit son avenir sanitaire. Ce leadership politique est à la fois opportun et nécessaire. Excellences, Mesdames et Messieurs, l'ambition de l'Afrique dans le cadre de l'agenda 2063, l'Afrique que nous voulons, se réalise également avec des professionnels de santé et des agents de santé communautaires forts, institutionnalisés dans le système de santé. Car les agents de santé communautaires restent au centre de l'aspiration 6 de l'agenda 2063 qui appelle à une Afrique dont le développement est guidé par les populations qui s'appuient sur le potentiel des Africains. Alors que nous entrons dans la deuxième décennie de la mise en œuvre de cet agenda 2063, notre objectif reste clair, inébranlable: revitaliser les soins de santé primaire, renforcer les services préventifs et promotionnels et renforcer les politiques et les programmes nationaux de ressources humaines en santé. La conférence de l'Union africaine a reconnu cet impératif en 2017, lorsqu'elle s'est engagée à recruter, à former et déployer 2 millions d'agents de santé communautaires institutionnalisés à travers le continent. Ancré dans le cadre catalytique de l'Union africaine pour mettre fin à l'infection à VIH, au paludisme et à la tuberculose, cet engagement identifie les systèmes de santé communautaires comme un facteur et un facilitateur transformateur pour les 3 maladies et progressivement pour les priorités plus larges de la santé publique. Elle est renforcée par la stratégie de santé africaine et fortement alignée sur la feuille de route de l'Union africaine vers 2030 et au-delà. Excellences, mesdames et messieurs, malgré les différents défis que chaque pays doit défier, des progrès ont effectivement été réalisés. Car si je ne parle que les ressources humaines en santé en général, en 2013, c'était aux environs 1,6 million. En 2022, ça devient 5 millions, y compris effectivement à l'intérieur les agents de santé communautaire. Ce qui va nous donner donc un espoir que d'ici 2030, il est possible d'avoir 2 millions d'agents communautaires inclus dans les ressources humaines en santé en général. La Commission est donc prête à continuer à travailler avec les États membres, les organes de l'Union africaine, les communautés économiques régionales et les partenaires pour surpasser les différents défis et pour garantir que l'engagement vers 2 millions d'agents de santé communautaires institutionnalisés devienne une réalité. Assurons-nous que chaque communauté de chaque État membre ait accès à des professionnels de santé de première ligne, formés, soutenus et suffisamment financés. Je vous remercie.
Thank you very much for those inspiring remarks in French. Excellencies, we have listened to the continental framing, and we will now hear from key global partners who are working hand in hand with African Union member states to translate this vision into impacts, particularly in strengthening immunization systems and community-based delivery platforms. I am pleased to invite Dr. Sania Nishtar, the Chief Executive Officer of Gavi, the Vaccine Alliance, to deliver a statement of support. She has sent in a video and it's going to be played now.
Excellencies, ladies and gentlemen, all protocol observed. Let me begin by saying we cannot predict the origin of the next crisis. We also cannot predict which community will face the next outbreak or which health system will be pushed to its limits. But one thing is clear. Without a robust health workforce and sustainable immunization programs, no country can withstand the shocks ahead. I also want to bring to your attention, with great humility, that since the year 2000, Gavi supported immunization programs powered by nurses, community health workers, logisticians, and countless frontline teams have protected more than 1 billion children and prevented over 20 million deaths. But the reality is that yet millions of children remain unvaccinated each year. And reaching them is fundamental to our mission as a vaccine alliance. It is fundamental to health security, and it is fundamental to why and how we have transformed our secretariat through a reform called the Gavi Leap. Through that transformation, we are embracing new approaches to support your health strategies and your priorities. We have great respect for your leadership. So going forward, more than 80% of Gavi resources will be channeled to Africa. Through the Gavi Leap reform, we are giving countries control on how Gavi resources are deployed. We are giving countries choice to select their technical partners. We are channeling more money through country systems, and we are using Gavi's innovative financing capabilities to help realize the African dream of vaccine sovereignty. This is the Lusaka Agenda in action. This is a concrete step to implement the Accra Reset and the African Health Sovereignty Movement. And here I want to emphasize that sustainable immunization systems do more than prevent outbreaks. They build trust, they reinforce primary health care. They are the bedrock of universal health coverage. And they give health workers the tools they need to protect families long before crises strike. I'm sure you will agree with me that trained, equipped, and supported health workers are the backbone of immunization systems. So let me emphasize that we at Gavi are more than committed to support you in building these systems. We will stand behind you as you take a lead. And I believe together we can create a future where every child is protected, every community is prepared, and every country stands stronger against the challenges to come. I wish you all a fruitful discussion, and we look forward to working with you in all the days ahead.
Thank you very much, Dr. Nishta, for reaffirming Gavi's strong partnership with African countries in advancing equitable and sustainable immunization systems. We will now hear from UNICEF, a long-standing partner to African governments in strengthening community health systems, primary health care, and immunization delivery. And to deliver the statements of support is Ms. Catherine Russell, the Executive Director of UNICEF, who is humbly represented in this meeting by Edgar Fogstad, the Global Director of Health. Let us give her a round of applause as she comes up to the stage.
Excellencies, Head of States and Governments, Chairperson of the African Union Commission, Director General of Africa, CDC, Ministers, partners, and your colleagues. I'm honored to join you today on behalf of our Executive Director, Catherine Russell of UNICEF. UNICEF speaks from years of standing with communities across Africa, in health centers, in villages, and alongside frontline and community health care workers, witnessing both the challenges and the extraordinary resilience and potential of this continent. When we speak about health security and sovereignty, we are really speaking about people. About the midwife who stays late because a mother is in labor. About the community healthcare worker, most often a woman, who walks for hours to reach a child who has not been vaccinated. About systems that either protect families or leave them exposed when a crisis strikes. And when those systems fail, it is always children who pay the highest price. Their rights to survive, to grow, and to thrive is the first to be compromised. That is why UNICEF stands firmly with the African Union's leadership today, because a strong health workforce and a strong community health systems are not optional. They are fundamental for strong and resilient primary healthcare systems, for gender equality, and for the realization of children's rights. Across Africa, community healthcare workers are quietly holding health systems together. They are often the first point of care, the first line of trust, and the first warning signal when disease emerges. They are the bridge between the health facilities and families, between policy and real life. And critically, they are predominantly women, women who deliver life-saving services, promote immunization, support maternal and newborn care, and safeguard child health. Yet, too often, do so without fair pay, adequate protection, safety, or formal recognition as professionals. Recent continental evidence, jointly led by Africa CDC and UNICEF with member states and partners through the Community Healthcare Delivery Partnership, confirms what many of us have long known for experience. Africa can make real progress. Child survival has improved over the past 2 decades, yet the job is unfinished. In 2023, nearly 3 million African children died, most from preventable causes. Over 7.8 million children in Africa did not receive any vaccine. Community healthcare workers have proven to be highly effective in addressing these gaps, improving immunization coverage, maternal and newborn care, early detection and treatment of common childhood illnesses, and ultimately reducing preventable child deaths. The fastest, highest return path forward is clear. Invest in strong primary healthcare, anchored in community health workers and sustainable immunization systems with appropriate referrals. With decisive leadership from the African Union, Africa can close the survival gap and secure its future. Africa is already demonstrating strong leadership and commitment. More than 1 million community healthcare workers are now serving their communities, reaching hundreds of millions of people, including families living through outbreaks and emergencies. And yet, that same evidence tells us something equally important. Progress is uneven and sustainability remains fragile. Too many community healthcare workers remain underpaid, unsupported, or dependent on short-term funding. Too many programs remain at the margins of national systems instead of being anchored at their core. If there is one lesson the world has learned from Ebola to COVID-19 to Mpox, it is this: preparedness does not begin in emergency rooms, it begins in communities. It begins with health workers who are trained, paid, supervised, equipped, protected, and respected. It begins with community health platforms that are integrated into primary health care and linked to strong immunization systems. And it begins with political choices made clear and sustained over time. There is no credible path to universal health coverage, no path to immunization equity, and no path to true health security without investing in community health workers as professionals, not volunteers of last resort. This is why UNICEF strongly supports the leadership being advanced through Africa CDC, the African Union, and the Community Health Delivery Partnership. CHDP represents something powerful, a commitment to country-led priorities, shared accountability, and long-term system building, not fragmented projects. This kind of partnership is exactly what this momentum demands. Excellencies, financing community health should not be optional. It is not a cost, but an investment. It is one of the smallest investments a country can make in stability, productivity, and human capital. When community healthcare workers are integrated into national wage bills, when primary health care is financed sustainability, when immunization and community platforms move together, health systems hold, even under pressure. And when they hold, children survive, thrive, and transform. Families are strengthened and societies are enriched. Kathy wanted to close with this. Africa's health security will not be built by declarations alone. It will be built by decisions you make in budgets, in institutions, and who you choose to protect. If we invest in community healthcare workers today, we invest in trust before crisis, in equity before emergency, and children before consequences. UNICEF stands ready with the African Union, African CDC, and all partners to turn ambitions into action and commitments into lasting systems. Because Africa's future depends on the people who protect its community and the children those communities raise. Thank you.
Thank you very much, Edgar, for those strong messages of partnership. Before we move to the next section, we'll be hearing from our continental leaders. I'd like to emphasize that we are not doing well with time, and so we will need to keep the next set of remarks to 2 minutes. I apologize, but that is the way it will have to be. And so very quickly, I'm pleased to invite Dr. Ibrahim Assai, the Minister of Health and Social Action of Senegal, to deliver his remarks. Let us give him a round of applause as he comes to take.
Merci beaucoup. Excellence, Monsieur le Vice-président de la République fédérale du Nigeria, Monsieur le représentant de la commissaire de la santé et des affaires humanitaires de l'Union africaine, Monsieur le directeur général du Centre africain de contrôle et de prévention des maladies Africa CDC, Messieurs et Madame les ministres, Madame la directrice générale de l'UNICEF, Madame la vice-présidente de la Fondation Buffett, Mesdames, Messieurs les chefs de délégation, Mesdames, Messieurs, tout protocole observé. C'est pour moi un honneur de prendre la parole sur un thème central pour l'avenir de notre continent. Renforcer la sécurité sanitaire et la souveraineté de l'Afrique, investir dans le personnel de la santé communautaire et les programmes de vaccination. Je tiens à remercier et à féliciter très chaleureusement la République fédérale du Nigeria et Africa CDC pour cette belle initiative. La sécurité sanitaire n'est plus uniquement une question technique. Elle est devenue une question de souveraineté stratégique et de développement durable. Notre continent supporte près de 24% de la charge de morbidité, alors qu'il ne dispose que de 3% des personnels de santé à l'échelle mondiale. Ce déséquilibre structurel fragilise notre capacité collective à anticiper, prévenir et répondre aux crises sanitaires. Pour renforcer durablement la sécurité sanitaire de l'Afrique, 3 investissements sont décisifs. Premièrement, investir dans le personnel de santé. La mise en œuvre du nouvel ordre de santé publique en Afrique exige des ressources humaines qualifiées, suffisantes et mieux préparées. L'initiative continentale visant à déployer 2 millions d'agents de santé communautaire d'ici 2030 constitue une avancée majeure. Plus qu'1 million sont déjà en activité, démontrant que notre continent est à la hauteur des enjeux. Ces professionnels de santé de proximité représentent la première ligne de défense face aux épidémies, aux urgences sanitaires et aux inégalités de santé, tout en renforçant la prévention. Deuxièmement, investir dans la santé communautaire. La sécurité sanitaire commence au niveau local. et repose sur des communautés informées, engagées et dotées de mécanismes de surveillance à base communautaire. Au Sénégal, la relance des soins de santé primaires s'inscrit dans la vision Sénégal 2050, qui place le capital humain au cœur de notre transformation systémique. Nous avons engagé une réforme structurante de la politique nationale de santé communautaire afin de renforcer la gouvernance, professionnaliser les acteurs, améliorer l'intégration des interventions et accélérer la digitalisation et la prévention au sein des communautés. Notre conviction est claire. Sans santé communautaire forte, il n'y a pu avoir ni équité sanitaire, ni résilience durable. Troisièmement, investir dans des programmes de vaccination durable. La souveraineté sanitaire africaine passe par la souveraineté vaccinale. Les crises sanitaires récentes ont révélé la vulnérabilité de notre dépendance extérieure. L'ambition continentale de produire 60% des besoins vaccinaux d'ici 2040 marque un tournant historique. Mais la durabilité des programmes de vaccination ne repose pas uniquement sur la production. Elles exigent uniquement des systèmes logistiques robustes, des capacités réglementaires renforcées, des financements durables en mobilisant aussi les ressources domestiques, une surveillance épidémiologique permanente et une recherche clinique, et surtout la confiance des populations. La souveraineté, la vaccination durable se construit dans les communautés à travers l'engagement des agents de santé de proximité et la lutte contre la désinformation. Excellence, la sécurité sanitaire de l'Afrique doit être considérée comme un bien public continental. Elle exige une solidarité renforcée entre nos États, une coordination accrue entre Africa CDC et les organisations régionales, un engagement politique constant en faveur des soins de santé primaires et la couverture sanitaire universelle. Investir dans le personnel de santé, renforcer la santé communautaire et bâtir des programmes de vaccination durables ne sont pas des choix sectoriels. Ce sont des décisions stratégiques pour garantir la souveraineté, la stabilité et le développement de notre continent. Le Sénégal réaffirme son engagement total aux côtés de l'Union africaine pour faire de la sécurité sanitaire le socle d'une Afrique résiliente, prospère et pleinement souveraine. Je vous remercie de votre aimable attention.
Thank you, Honorable Minister. Very quickly, we will now hear from a country that has long been a pioneer in primary health care and community-based service delivery on our continent. Ethiopia's global recognized health extension worker program has demonstrated how sustained investment in community health can transform access, equity, and health outcomes at scale. It is therefore my great pleasure to invite Mrs. Seherela Abdullahi, the State Minister of Health Systems and Capacity, Federal Republic of Ethiopia, to deliver her remarks. 2 minutes, ma.
Good evening, everyone. Your Excellency, Ms. Kashim Shettima, Vice President of the Federal Republic of Nigeria and the AU Champion of the Human Resource for Health and the Community Health Delivery Partnership, His Excellency, Honorable Minister from Nigeria, Senegal, and across our continent, His Excellency Ahmed Ali Yusuf, but he's not here, the delegate from the African Union Commission, His Excellency Dr. Jean Kasai, Director General of the African Center for Disease Control and Prevention, Honorable Ministers from Senegal, Malawi, Botswana, ladies and gentlemen, distinguished guests. I'm honored to address on behalf of Her Excellency Minister Dr. Magdas Daba, the Federal State of Ethiopia, to address this distinguished gathering on behalf of the government in Ethiopia. People of Ethiopia, I speak to you at a pivotal moment for Africa's health future, a moment that calls for reflection, realism, and renewed our political resolves. Across our continent, public health threats are becoming more frequent, more complex, and more interconnected, climate shocks. Infectious disease outbreak and rising non-communicable disease are stretching all the systems in unprecedented ways. Preparedness is no longer a theoretical aspiration, it's a daily operational necessity. Ethiopia's experience mirrors this continental's reality. Pandemic preparedness is not built in laboratory alone, it's built by people and by the system that reach community early, consistently, and with trust. In Ethiopia, our health sector's transformation plan deliberately grounded health security in community-based systems through the health extension program and the multi-sectoral WORDA transformation agenda. We placed community at the center of preparedness, prevention, and response. Model households, model qabeles, high-performing primary healthcare units, and the transformed district leadership become the building block of resilience. This approach reflects simple but powerful lessons. Health security development and social resilience converge at the community level. Whether health intersects with education, livelihoods, water and sanitation, and the local governments. Excellencies, yet strong systems requires people to run them. At the start of Ethiopia's reform journey, our health work density stood at approximately 1 per 1,000 population, far below what is required to achieve universal health coverage. Like many Africans, we face not only shortage, but also critical skill mix gaps, particularly in midwifery, anesthesia, laboratory science, pharmacy, and specialist care. In response, Ethiopia invested in scaling up pre-service education, specialization, expanding medical residency program across public university, strengthening nursing and midwifery training, and progressively upgrading health extension workers to meet evolving community needs. These investments were essential to build a workforce capable of sustaining primary health care and responding emergencies. Community health workers play a central role in the equation. Ethiopia's health extension workers are often the first to detect unusual health events, the first to report alerts, and the first to mobilize the community trust. Their role demonstrates why community health workers are not peripheral to preparedness, they are foundational to it. It's in the context, the Ethiopian strongly supports the African Union targets of 2 million community health workers by 2030. This target reflects continental recognition that primarily healthcare and community performance are the backbone of the health security, universal health coverage, and pandemic preparedness. Ethiopia's experience under the health sector transformation plan to show that this vision is achievable when community health is institutionalized, professionalized, and linked to broader health system reforms. However, no workforce strategy is sustainable without a domestic financing. Ethiopian health financing journey reflects its difficulty faced by many countries in a new global context to constrained aid and rising demand. While overall health expenditure has grown, gaps remain, reinforcing the importance of mobilizing domestic resources more efficiently and strategically. In this regard, Ethiopia is aligned strongly with African CDC agenda on the financing health security in a new era, which calls the predictable domestically anchored investment in people-centered health system as a foundation for sovereignty, resilience, and preparedness. Health security cannot be imported. It must be financed, governed, and sustained at home. Excellencies, ladies and distinguished guests, drawing from Ethiopian national experience, we therefore join this gathering in calling for sustained political leadership to elevate the workforce of the community health as a strategic pillar of the health security and the universal health coverage. A stronger cross-sectoral coordination between health, finance, education, and labor. Increased and more efficient domestic investment in the health workforce, including community health workers. Ethical and mutual beneficial approach to health workers, migration and skill circulations, and continued strengthening of Africa's CDC as the continental anchor for preparedness and workforce transformation. In my conclusion, Africa has already demonstrated what is possible when we act together. Now we must show the same unity and resolve in investing in our people. Let us choose preparedness. Let us choose solidarity. Let us choose future where African health security is built from the ground up and sustained by its own system, its own workforce, its own leadership. I thank you once again.
Thank you very much, Honorable Minister. We'll move very quickly to a country that continues to make important strides in strengthening its health workforce, expanding access to primary health care, and integrating community-based approaches to reach the most vulnerable population. I am pleased to invite Honorable Madalisto Baloyi, the Minister of Health and Sanitation, Republic of Malawi, to deliver her remarks.
The Vice President of the Federal Republic of Nigeria, the Chairperson of African Union Commission, Director General Africa CDC, distinguished ministers present, partners, all protocol observed, ladies and gentlemen. On behalf of the government of the people of Malawi, I commend the government of Nigeria and Africa CDC and the Africa Union Commission for Health, Humanitarian Affairs, and Social Development for convening this high-level side event on building Africa's health security and sovereignty under a powerful theme of investing in the health workforce, community health, and sustainable immunization program. This timely gathering reflects Africa's shared resolve to place people, preparedness, and sustainability at the center of our health agenda. Furthermore, this event highlights a vision that is critical not only to Africa's future, but also to the dignity, self-reliance, and well-being of our people. This is in full alignment with the commitment of His Excellency Professor Peter Mutharika, the President of the Republic of Malawi, who has consistently championed sustainable development, health equity, and empowerment of communities as pillars of Malawi's national and continental growth. At the heart of this agenda lies the truth that we can't afford to ignore, and that strong health system is built on the foundation of a well-supported health workforce and resilient health systems that grow from empowered communities. Primary health care is where the truth comes alive. When it works, communities flourish, children grow healthy, families thrive, and hope is nurtured. When it falters, vulnerabilities deepen and people suffer. Every investment in health workers' skills, their capacity, and their connection to the communities they serve is not just a policy choice. It is an act of care and commitment to the future of our people. This side event also takes place at a defining moment for Africa, where we are on a path towards universal health coverage by 2030. Yet, we face unprecedented health challenges. Official development assistance has declined significantly, placing additional pressure on already fragile health systems. At the same time, the frequency of disease outbreaks such as cholera, Ebola, Mpox, and others have increased. Alongside the rising burden of non-communicable diseases and persistent infectious diseases such as HIV, tuberculosis, and malaria. These challenges are compounded by the growing health impacts of climate change, which threaten the well-being of our people, particularly in Africa. Malawi strongly welcomes and fully supports the Africa Health Security and Sovereignty Agenda led by the African CDC. This is not merely a policy framework, it is a continental commitment to move Africa from crisis response to preparedness, from fragmented action to coordinated continent-wide effort. Excellencies, distinguished ministers, ladies and gentlemen, I urge all of us to take bold action in supporting of building Africa's health security and sovereignty, an agenda that demands investment in our people, our communities, and our system. Let us secure sustainable immunization financing that integrates immunization into national health plans, support local and regional vaccine production, and adopt pooled procurement to guarantee access to life-saving vaccines. Let us invest in the health workforce, train, deploy, and retain our health workers, and empower community workers as the backbone of primary health care. Strengthen community health systems, place communities at the center of prevention, surveillance, and response, ensuring resilient and digitally enabled primary care. Let us demonstrate strong political leadership, predictable financing, and collective action. Health security and sovereignty require all of us to work together. In closing, Malawi stands fully committed to this agenda. Together, we can build a healthier, stronger, and more self-reliant Africa. I thank you all.
Thank you very much, Honorable Minister, for those forward-looking remarks. We approach the climax of this event. Your Excellency, distinguished delegates, we're approaching the climax of this event, and I have the honor once again to invite the Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, to introduce our next speaker. Please let us give him a round of applause.
Thank you, Excellencies. It is indeed an honor for me to introduce His Excellency Senator Kashim Shettima, GCON, Vice President of the Federal Republic of Nigeria, who is here representing His Excellency President Bola Ahmed Tinubu, GCFR, the African Union champion for health workforce and community health delivery. I think he is someone that I think we are very, very privileged to have here with us. An intellectual of huge depth, an economist, a vast politician, but importantly, a doer, supporting our president. So, Mr. Vice President.
Kindly take your seats, please. He is from the Democratic Republic of Congo. His nation covers 2,344,858 square kilometers, the size of Western Europe and potentially one of the richest countries in the world. My brother, my friend, Dr. Jen Kasia. He was born in Kinshasa in 1970, educated at the University of Kinshasa and Poitiers in France. Most importantly, he is fluent in about 7 languages. He speaks French, English, in addition to Kikongo, Shiluba, Swahili, and of course, Lingala. The honorable ministers from across Africa, from Nigeria, the Foreign Minister and the Minister of Health, our Minister from the Federal Republic of Ethiopia, and our newest member in the club, the Minister from Malawi. And of course, the Minister from my adopted country of Senegal, the Health Minister of Senegal. Distinguished heads of delegation, excellencies, partners and friends of Africa, ladies and gentlemen. There is no doubt that each country here reached an awakening on health security about 6 years ago. The COVID-19 outbreak was a reset button in a world that had underestimated its health risk. And each of us emerged from the tragedy with a resolve to never experience such a pace again, without the infrastructure to protect our people and to protect the world. This day is yet another pursuit of that dream. We are here today to interrogate the distance between our aspirations for a healthier Africa and our capacities to deliver on that dream. So the question before us is both immediate and practical. Can Africa protect African lives with African capacity? That is the essence of what we call health security sovereignty. Your Excellencies, distinguished ladies and gentlemen, sovereignty in this context does not mean isolation from the world, far from it. It does not mean retreat from global cooperation. It means preparedness anchored in competence. It means the ability to prevent outbreaks where we can, to detect them swiftly when we cannot prevent them, and to respond decisively before a local crisis becomes a continental or global emergency. It means that the health of our people is not subject to the uncertainties of distant supply chains or the shifting priorities of global panic. We have all lived through the consequences of vulnerability. When the world turned inward, Africa waited. When vaccines were rationed, Africa negotiated. When oxygen was scarce, Africa improvised. There is dignity in endurance, but endurance is not a strategy. Leadership is measured not by how long we can withstand vulnerability, but by how deliberately we reduce it. Health security is national security. And in an interconnected continent, national security is continental security. A virus, as we have witnessed, does not carry a passport. A counterfeit medicine does not respect a border. A pandemic does not wait for bureaucracy. Nigeria has approached this challenge with seriousness under the leadership of His Excellency President Ahmed Bola Tinubu. In December 2023, we launched the Nigeria Health Sector Renewal Investment Initiative, securing over $2.2 billion in health sector commitments anchored in measurable outcomes. The initiative set out to renovate and revitalize more than 17,000 primary healthcare centers across our federation, to train 120,000 frontline health workers, and to expand health insurance coverage within 3 years through reforms driven by the National Health Insurance Authority. We prioritize this because we believe that sovereignty must rest on financial protection as much as on infrastructure. The success of our responses to disease outbreaks that overwhelm the world is because we have strengthened epidemic intelligence and emergency preparedness. Through the Nigeria Center for Disease Control and Prevention, we are enhancing laboratory networks, expanding genomic surveillance, and reinforcing coordination at our emergency operation centers. This is because in public health, time is currency. At the same time, we have intensified regulatory oversight under the National Agency for Food and Drug Administration and Control. We are upgrading quality control laboratories, tightening enforcement against substandard and falsified medicines, and streamlining processes for compliant manufacturers. Sovereignty without standard is not sovereignty. It is exposure to risk. Beyond public systems, we have moved to unlock the healthcare value chain. to remove the structural bottlenecks facing domestic pharmaceutical manufacturers, medical device assemblers, and biotechnology innovators. We have set in place the presidential initiative to unlock the healthcare value chain. We do so to catalyze investment in local drug manufacturing, diagnostics production, and biotechnology research. Excellencies, distinguished ladies and gentlemen, allow me to draw your attention to a living example of what African ambition can achieve when vision is matched with capital and expertise. In Abuja, Nigeria, recently welcomed the birth of the African Medical Center of Excellence, an initiative of the African Export-Import Bank in partnership with King's College Hospital, London. This center houses the largest stem cell laboratory in West Africa and is designed as a hub for advanced oncology, hematology, cardiology, and transplant services. It integrates clinical care with research, training, and medical education. For decades, Africa exported patients and expertise. The African Medical Center of Excellence signals a reversal of that narrative. It demonstrates that African institutions, supported by host nations, financed by African capital, and strengthened by global partnerships, can deliver world-class tertiary care on African soil. However, governments cannot build this future alone. The private sector is not an accessory to Africa's healthcare sovereignty agenda. It is central to it. In Nigeria, companies such as May and Baker Nigeria PLC, Pitson Healthcare PLC, and Emdo Pharmaceutical Industries Limited have demonstrated that local pharmaceutical production can meet rigorous standards and supply essential medicines at scale. Diagnostics innovators such as Codex Bio Limited and digital health platforms like Helium Health are building the data and testing infrastructure that underpins surveillance and efficient service delivery. Yet across our continent, manufacturers and innovators face systemic constraints. High energy costs erode competitiveness, fragmented markets limit economies of scale, duplicative regulatory processes delay entry into neighboring jurisdictions. Procurement cycles are often unpredictable, discouraging long-term investment. Capital is allergic to ambiguity, not risk. If we desire factories, we must create markets that are predictable and harmonized. If we want vaccines, diagnostics, and essential medicines manufactured in Africa, we must reduce regulatory fragmentation and full procurement frameworks that make investment bankable. Our call, therefore, is both continental and practical. We must deepen regulatory harmonization so that a product approved to high standards in one African country does not face unnecessary duplication in another. We must commit to multi-year procurement frameworks that provide demand visibility to manufacturers. We must invest in workforce development in biomanufacturing, biomedical engineering, and regulatory science. We must strengthen anti-counterfeit enforcement and supply chain transparency to protect both patients and legitimate businesses. To our development partners, we express gratitude for solidarity, but we urge a shift in emphasis from emergency shipments to systemic capacity. To Africa's private sector and global investors, we must always keep in mind that Africa's health market is one of the defining frontiers of this century. By mid-century, our continent will be a home to a quarter of the world's population. By 2050, Nigeria will be the fourth most populous nation on earth, will supplant the United States, will be the third most populous nation on earth. Ethiopia is hovering in the region of 150 million. DRC is over 100 million. So the trajectory of global growth, as I've always said, is facing Africa. And those nations in Africa will make or mar that transition. We are the youngest continent. We'll provide the global workforce. Asia is aging. So also is the Western world, the United States inclusive. So the future actually belongs to Africa. Excellencies, distinguished ladies and gentlemen, we are in no doubt that sovereignty is not a plaque we wear. It is a promise we keep. It is a promise that the next health emergency will find Africa prepared, not pleading. A promise that our children's survival will not depend on the speed of decisions taken thousands of kilometers away. A promise that African governance, African enterprise, and African innovation can converge to secure African lives. Nigeria stands ready to collaborate with every member state of our union to make health security sovereignty measurable in factories commissioned, laboratories accredited, health workers trained, counterfeit markets dismantled, and insurance coverage expanded. When history reflects on this generation of African leadership, may it record that when confronted with vulnerability, we choose capacity. When confronted with dependence, we choose dignity. And when confronted with uncertainty, we choose cooperation. And in choosing cooperation, we build a continent that will heal itself. Finally, before I say goodbye, I want to pay tribute to this gentleman seated here, Mohammed Ali Pate. Africa is not a land of fraudsters. He left a job in Gavi, earning $2.4 million to accept a $500 per month job to serve his country. He's a man of impeccable integrity and credentials. The only sad component is that he wants to be the governor of Bauchi State. And I feel he has come ahead of his time. I prepare him to work at the center, adding value to our society, than going to governance at the local level. You are an African treasure. You are well bigger than small Bauchi State with a population of 10 million people. Thank you, and God bless the continent of Africa.
Thank you very much, Your Excellency, for those inspiring keynote address that we've just heard. As we round up and wind down the session, we're going to be building on the strong political messages and commitments we've heard today to present the communique, which captures key priority actions to strengthen Africa's health workforce, scale up community health systems, and ensure sustainable immunization programs. I'm therefore pleased to once again invite the Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, to present the communique.
Thank you, Your Excellency, for those inspiring remarks and for all those who've made presentations. And on that last point, Your Excellency, I assure you that whatever you and my boss and you and Mr. President agree on is what will happen. So thank you for your confidence and thank you for your kind words. I think the task now for us as we wrap up is to agree on the communique. Today, 13th February 2026, I believe the communique is being presented. We, the Ministers of Health and Finance of African Union member states, together with heads of delegations, participating in the high-level side event themed Building Africa's Health Sovereignty health security and sovereignty, investing in the health workforce, community health and sustainable immunizations program, convened on the margins of the 39th Ordinary Session of the African Union Assembly in Addis Ababa, Ethiopia. Preamble. Mindful that Africa, a continent of over 1.5 billion people, continues to experience a high frequency of public health emergencies, including infectious disease outbreaks, climate-related shocks, and humanitarian crises. Concerned by the persistent burden of preventable morbidity and mortality from communicable and non-communicable diseases, maternal and newborn health conditions, an increasing strain on health systems exacerbated by climate change and human resources for health challenges. Recognizing that Africa bears more than 25% of the global disease burden, while accounting for a disproportionate 3% of the global health workforce. Acknowledging that a fit-for-purpose, well-supported and equitably distributed health workforce, particularly community health workers, is foundational to primary health care, universal health coverage, and pandemic prevention, preparedness, and response. Recalling the collective commitments of African Union member states, including the Abuja Declaration to allocate at least 15% of national budgets to health, the Assembly decision to recruit, train, and deploy 2 million community health workers across the continent since 2017, the Assembly decision establishing the African Union Health Workforce Task Team to strengthen continental coordination of 2022, and the Assembly decision designating His Excellency President Bola Ahmed Tinubu, GCFR, as the African Union Champion for Human Resources for Health and Community Health Delivery Partnership, thereby elevating health workforce and community health as sustained political priorities for Africa's health security. Welcoming the leadership of the Africa CDC and the progress made in strengthening evidence, coordination mechanisms, and continental tools to advance health workforce development and community health systems, including Africa CDC Commission work on health workforce financing options to inform national planning and support continental advocacy. The communique reads, we, the Ministers of Health and Finance, convene under the leadership of His Excellency Senator Kashim Shettima, GCON, Vice President of the Federal Republic of Nigeria, representing His Excellency President Bola Ahmed Tinubu, GCFR, the AU Champion for Human Resources for Health and Community Health Delivery Partnership, and guided by the deliberations of this high-level side event, hereby call upon African Union heads of state and government, member states and development partners to strengthen political commitment and increase sustained investment in human resources for health and community health systems, and agree on the following. 1, provide sustained political leadership. We call on African Union heads of state and government to elevate HRH and community health workers as strategic pillars for primary health care, universal health coverage, and pandemic prevention, preparedness, and response. 2, to strengthen health workforce systems. We note with appreciation the AU Health Workforce Compact and affirm the AU Health Workforce Task Team as the principal continental coordination and accountability mechanism for human resources for health. Direct the Africa CDC in consultation with member states to advance continental standards for health professionals, education and training, support progress towards mutual recognition of professional qualifications, and strengthen workforce data system to enable evidence-based planning, deployment, and accountability. Direct the Africa CDC to report on progress to the Media Coordination Meeting in July 2026 and all governance structures of the Africa CDC and AU policy organs. 3, to accelerate progress towards continental target of 2 million community health workers by 2030. We reaffirm the continental commitment to recruit, train, deploy, institutionalize, and sustainably support 2 million community health workers by 2030 and call on member states to accelerate their integration into national primary health care systems, ensuring fair remuneration, adequate protection, supervision, career pathways, and alignment with immunization and pandemic prevention, preparedness and response priorities, particularly for underserved, zero-dose and hard-to-reach populations. To also roll out the Continental Community Health Program scorecard at both political and the program levels to track progress and ensure accountability of member states in alignment with the Lusaka agenda. 4, increase and sustain domestic financing for health workforce and community health systems. We call on member states to increase and sustain domestic investment in the health workforce development and community health workers in line with the Abuja Declaration and the Africa Health Workforce Investment Charter, and to strengthen cross-sectoral coordination among ministries of health, finance, education, labor, and the civil service. To direct also the Africa CDC to intensify its work with relevant stakeholders to identify and access sustainable financing options for national HRH and community health programs and report to the Africa Union Assembly. Call on member states on regular reporting through the Africa CDC to the Assembly of Africa Union on the progress towards the 2030 target, and with health workforce investments aligned to strengthen routine immunization and life course vaccination across community and facility-based service delivery. 5th, to develop and finance the continental and national community health acceleration plans. We commit to developing comprehensive costed acceleration plans for community health workers at the continental and national levels, aligned with the continental target of 2 million CHWs by 2030. Directs the Africa CDC and the Continental Coordination Mechanism for Community Health to convene a high-level continental meeting in Abuja later this year, before June 2026, to support member states in finalizing costed national CHW replenishment and acceleration plans, and to launch the Continental Community Health Acceleration Plan. We call on ministers of finance to participate actively in this process and to ensure that national CHW acceleration plans are integrated into national budgets and medium-term expenditure frameworks with dedicated budget lines and sustainable financing mechanisms. And we call on our development partners, development finance institutions, the private sector, bilateral partners, and philanthropists to align catalytic and blended financing behind government-led, costed human resource for health strategies and community health acceleration plans. Support fiscal sustainability by integrating HRH and CHW plans into national budgets and their medium-term expenditure frameworks. Adopted in Addis Ababa, Ethiopia on the 13th of February, 2026. That's the end of the communique. Thank you very much.
Thank you very much, Honorable Coordinating Minister of Health and Social Welfare. You will agree with me that the communique captures the spirit of today's events: political ownership, domestic financing, accountability, and partnership in advancing Africa's health workforce, community health workers, and immunization programs. As we wind down, I'd like to once again, on behalf of the co-hosts of this event, the government of Nigeria, the African Union Commission, and the Africa CDC, sincerely thank Your Excellency, the Vice President of the Federal Republic of Nigeria, the Honorable Ministers of Health, Finance, all Your Excellencies here and distinguished participants for your presence, your participation, and your leadership. We have two very important agenda items to formally bring this side event to a close. Number one would be the vote of thanks. And right after that, there will be a family photo that will be taken with His Excellency, the Vice President, and the principal dignitary, the ministries that are in the room. Just to add also that light refreshments have been provided and to be taken right outside the hall. On that note, may I kindly once again invite Dr. Jean Kaseya, the Director General, Africa CDC, to deliver a vote of thanks. A round of applause for him, please.
Your Excellency Shetima, Vice President of the Republic of Nigeria, I was saying when you speak, people are crying. Maybe you didn't see in the room. I saw people crying when you were speaking. And I saw my brother laughing. It's just miraculous what you are doing. Thank you so much. Professor Ali Pate, let me tell you, colleagues, Professor Pate, I had 2 deputy prime ministers because coordinating minister in my country will be the deputy prime minister. Last week, one of them was just appointed minister. It means I just have you, a deputy prime minister. It means you are coordinating all of these ministers. It's a huge responsibility. And you decided not to attend the Global Fund Board meeting. Maybe people, they don't know, Global Fund Board is meeting now. You decided to be here with your brothers and sisters under the leadership of our VP and other head of state to support the African agenda. When the VP said he's a great man, a man of so many values, this one is one of the values that I know from you. Thank you so much. Minister of Finance, Minister of Health here present, partners and colleagues, allow me, please, to express our deepest appreciation to His Excellency President Bola Ahmed Tinubu for his continental leadership. I can remember the first meeting I had with President Bola Tinubu. I was telling him, President, we will have another pandemic. And he told me, tell me how to stop pandemic, not tell me, don't tell me another pandemic is coming. Because it was the day he decided to become the champion. And here is represented by the Vice President, means it's not just an individual, a personal agenda. It becomes a national agenda because the VP is here on behalf of the President. Thank you so much. I want to extend our appreciation to our partners. There are so many here at the highest level, senior people who came from Geneva, from New York, from everywhere to attend this meeting. Thank you to our multilateral agencies, our CSOs, they are here, and the private sector for their collaboration and support. I want also to thank the Nigerian ambassador to AU, my brother, Ambassador Nasir. He played a key role for this meeting to take place. Let me confess, there was a time I was even saying maybe the meeting will not take place, but he managed to bring us together. Minister, you have to say to our ambassador, he's a great support. I want also to thank that our moderator, you were so great. And that our moderator, you were so great. And I think, please don't just moderate a Nigerian event, please also to moderate other events. We'll meet in Abuja. Our leader is sitting in Abuja. I was saying I was requesting permission from Minister Pate. If we can have this biggest event on investment case on community focus in Abuja under the leadership of President Bola Tinubu. Please, if it will be on the margins of AMR, it's okay. But our role as Africa CDC is to sensitize all of our brothers and sisters minister to come to Abuja, even to advocate for some head of state to attend. This will show that we are taking this agenda more seriously under the leadership of President Bola Tinubu. Thank you so much. It was just to say thank you to all of you. If there is someone I forget, it's my fault. It's not the note that they prepared for me. Thank you so much.
Thank you so much, DG. Finally, may I kindly invite His Excellency for a family picture. In front, right in front. Your Excellency, yes. He is going to be joined by the ministers in the room.